And it's about also setting goals, right? You just don't want to let them loose without any idea of what they're supposed to do. So setting goals, I want you to exercise 20 minutes a day per, you know, 3 days a week, right? And write those down and bring those back in next time you come and see me and let me see how you did.
Dr. Smith, so we have some listener questions that they wanted to ask. So one of them would be like, how is it that I know that I'm at risk of going into frank diabetes? What is it that I need to look out for?
Sure. It's early on, it's really, really hard to know. I think the biggest clues are family history. And we're talking about type 2 diabetes now. Type
Right.
1, obviously different
Yes.
for juvenile diabetes. Type 2, there's often a family history. So your mom, your dad, you look at your family tree a little bit, your older brother, your older sister. Uh, and I encourage people who have a family history to really come in earlier and to start checking themselves with, fasting blood sugars during part of a physical, even in sometimes in their 30s, we'll bring them in and check. So sometimes you just have to go to the doctor and get checked. There may not be a whole lot of symptoms there. There are symptoms of diabetes, but the symptoms you hear about, I'm urinating more, I'm very, very thirsty, I'm tired, I'm losing weight. That's when you really are way, way over the chain already. You're already there. So we want to get those folks before that. So your biggest clue is looking at your family history. And then if you happen to be overweight and a bit sedentary, that's maybe something to get in and see the doctor about anyway. But that may be another reason why we would want to check a fasting blood sugar on you. So, once a year to have a physical done and get a fasting blood sugar, even if you don't have symptoms, would be something I would recommend. For general, I mean, everybody should have physical, right? Every year. It becomes more important as you get over 40. But if you have a family history, we would want to bring you in sooner than that and do some checks on a regular basis before that.
And how would you recommend, like, there was another question, how frequently should a person who has pre-diabetes be visiting their doctor?
So that's a good question, depending on how we're going to create the care model, right? So in a standard doctor dominated world, we would bring you in every 3 to 6 months and have those sugar tests run again, fasting blood sugar, A1C. I was a bit more aggressive with that personally. I'd try to get them to come every 3 months to get checked. Nowadays, if we're going to try to revamp the care model a little bit, maybe we think about it differently. Maybe we think about more touch points virtually, using data on the app that gets sent to me. I think there are different ways that we could explore that. And I think that almost has to be an individual discussion with your provider of how much you're willing to do, as a provider, more the better, right? But if, at the bare minimum, I would want to check their sugars every 3 months to see what they're trending.
Mm. And would it be worthwhile meeting a behavioral specialist, even as a preventive measure for a person who already has prediabetes or type 2 diabetes?
The answer unequivocally to me is yes. I think that in the world of 2025, there's still insurance barriers sometimes, it's cost, it's time. But these visits, again, can be done virtually, sitting at home with a provider somewhere else and having a discussion like we're having over a virtual connection can save time with travel and driving and all of that, much more convenient. And then I think also if we think about wellness apps and things that we can connect people to with technology, could be a way to do that as well. But I think the answer to me in a perfect world is yes, everyone with prediabetes or a tendency to high blood sugars, I'd get them in with somebody to talk about their mental wellness, how they're doing that way, diet, exercise, all of that as a base to this treatment.
Okay, wonderful. And what is your advice to patients in terms of, how should they be prepared in going to their doctor? What is it that they need to like pre-plan before they meet their doctor?
As I was doing these visits, and I had a very very busy primary care practice, I loved it when people came prepared. So when I first started being a doctor, I was annoyed by people who would bring in a list of 5 or 6 questions. I grew quickly to love that because then we're organized, right? You can hit these questions, boom, 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 boom. Let's talk about them all. Let's take care of your question. So if you have a question, don't be afraid to ask your provider. That's what you're there for. So if you can come prepared, that's great. Also, if you could know the medicines you're on, how many times a day you take them, what the dosage is. If you have an app that does that for you, that's great. But having a knowledge of what medicines you're on, your medical conditions, and your family history is so important to me as a provider so that I can make a really good plan for you. And then if you have data, if you have your glucose monitor, bring it in with you. If you have an app that connects to your CGM, bring that in with you. And we can sit down and we can look at it right there. So the more you can be prepared for that by doing those things, the more efficient I can be in a visit with you, and the more we can get done.
Nice. And what are the some of the tools and resources that you would provide your patients in terms of helping with better management of their diabetes? And you touched upon some of the wellness apps and health apps, and what is it in general that patients should be using or utilizing to help with their diabetes management?
Again, I'll kind of skirt that by saying it's an individual decision. It depends on what the patient is going to be willing to do. Uh, in a perfect world, again, I would love them all to have CGMs on with an app to connect to in their phone that could bring that into me. They would have, my organization's my chart, if you will, or whatever equivalent patient portal that we can communicate that way with them. I would hope that I would have a really great team around me that would connect with them either virtually or by the phone or somehow, through as we go. And yeah, I think getting them sort of a resource list of really great websites that we trust, we meaning the organization I work for, or me myself, or to get them more information because, again, still, I guess we're calling this the information age, right? Everybody wants more information. And so the more information, good information, I don't want them just Googling, how do I fix diabetes and coming up with crazy things, but good reputable websites and ways to, I think it's really important to give them the resource to how do you connect to me? Right?
Mhm.
You may not get me, but you're going to get someone on my care team. And most of the time, they're going to take care of those questions. But if they don't, they're going to come to me and I'm going to make that decision. So telling them, this is how you get a hold of me. And don't be afraid to use this tool.
Right. Right. Very well said. Dr. Smith, one last thing. You talked about trust.
Yeah.
Now, it's very important that, because there are a lot of healthcare programs out there, there are a lot of health and wellness apps out there, and it becomes very difficult to understand which one to rely on. If you can give us, like, 3 parameters where, what is it that a person should look at in terms of, I can probably go with this one. Uh,
Mhm.
what would that be?
I think a complete package of, you don't want something that just does one thing here. I think we made clear in this podcast, treating diabetes is a net you have to cast wide, right? Something that's going to give you some advice on how to manage your sugars and your diet, but also is going to encourage you to exercise and figure out ways of connecting to your Apple Watch or your Fitbit or whatever to take a look at your exercise patterns, encouraging you, providing positive reinforcement. And, a really great app would connect then somehow either to your care team or to the care team at that app that can then say, oh, this is bad. We need to send this along to someone. Um, I'm a big privacy person, so you want to make sure that the app, takes care of your data and isn't doing crazy things with your data because it's you and it's very, very, health data is very, very important. And we have to make sure that those things are tended very carefully. And I think one that is really kind of always thinking the next step, what is the next step that we can do? So adding features to the app is not just a kind of a flatline app that doesn't really grow and change over time. It's a hard one, but I think, because people it is hard for just the general public to say, well, I got 6 apps in front of me. How do I know which one is the best? I don't have a really great answer early to say, well, just pick one and or look at the reviews or look at how much traffic it has on it. I mean, obviously, if you have an app that has, 1 million users and then you have another one with 300, that's an indicator, but not always. I mean, you can have a really great app, but it's just not known yet, So I think there's a lot of factors in that. I think to me, as I mentioned earlier, demonstrating effectiveness. I mean, if this app comes out and says, look, here our users have shown a decrease in their A1C in the first 6 months by 13%, making up numbers. But that's big, right? And so as opposed to an app that just doesn't have any results published at all. I think that would be something I would look at. It's almost like an Airbnb with 2 reviews, or do you trust one that has 300 and they're all 4.9, right? I mean, that's the hard thing for the new apps when they first come out. But, in time when the new apps get out there and they show effectiveness, show your work, just like in school, show your work. And that is what I would suggest to look at.
Very well said. So the it sums up kind of what we'd already discussed, bringing multiple disciplines in
Yep.
one
Yep.
place, and also like showing the effectiveness of the program. I would like to add three more points, if I may. So
Of course.
a lot of times when a person chooses an app, I think there has to be some alignment with their goals. I think
Yes.
what they feel they want to achieve has to be aligned with what the app is or the wellness program is going to help you achieve. But also, it has to be realistic, is my second point that I would want to make. So, it has to be that, okay, I'm not going to have you drop your BMI from X to 100% or 50% Y. So that's an unrealistic goal, and that should make you wonder, I mean, how is it possible? And then the third point is it really sustainable? So if they are giving some unrealistic goal, would it be possible for you to sustain it for long? Because ultimately, for most part, most people are able to lose the weight or they lose the BMI that they have gained, and able to cut down on their glucose levels. But then once the weight comes back on, suddenly the diabetes is going to come back with a vengeance.
Right.
So that is what we want to look at. So that sustainability has to be definitely be there. Would be my 3 points into this. But
I think those are fantastic. And sustainability goes to my last point, which is growth, right? And change and adaptability of the app. If you see one that's been around who's constantly adding new features or at least growing what they're offering, that's how you can be successful with that too, I think, because you're incorporating all of those things.
great. Dr. Smith, I've had a wonderful time
Yeah,
today, and
me too.
these discussions have been fantastic. I'm sure the listeners are really going to enjoy with all the contributions, all the thoughts that you have portrayed today. And thank you for your time today and being here today.
Happy to do it. Really enjoyed it. Thank you.
Same here. Thank you so much.